Unfortunately, traditionally, we haven't had many great options in treating eyelid conditions or skin conditions. During my training, we would offer patients baby shampoo as cleansers, and that used to be quite irritating to the ocular surface and really didn't get to the crux of the problem. So yes, traditional treatment has not been very successful in treating eyelid or skin conditions. What I have found since Clearadex has become an option for our patients is that the effect on the eyelid condition in treating the eyelid condition, anterior blepharitis, in these patients, as well as their skin problems, has been much more impactful. So patients are clearly seeing results much sooner. I see results much faster. Many patients who were failures on the traditional treatments came to me with continual complaints of itching and irritation. I even can think of a patient with corneal erosions and one with a near perforation who then I switched to Clearadex treatment, and after 6 weeks of treatment had resolutions of their symptoms and clearing of their cornea. So in comparison to steroids, the risk factors associated with Clearadex is really minimal. Sometimes though, in those very severe patients, I have had to use both, but then maintain them on a longer course of the Clearadex, but take them off of the steroids within weeks. It's different from our traditional treatment because it really gets to the crux of the problem. It has the tea tree oil, which sterilizes the lid margin, and specifically for those patients who have rosacea and Demodex blepharitis, it really does kill the bugs and the critters and gets to the crux of the problem, to the base of the problem. And I've seen this from plucking lashes prior to treatment and looking at these lashes under the microscope, and then after a course of treatment, reevaluating and truly seeing the resolution of the problem. Clearadex in some patients, if I catch them early on in their spectrum of disease, could potentially cure their problem. But in those patients with very severe blepharitis, it may lead to a maintenance therapy. So it really depends on how aggressive the ophthalmologist is in treating patients early. So we don't know what the exact prevalence of Demodex blepharitis is. We also don't know if every patient who has Demodex is symptomatic. So this is all not very clear yet. What I do know is that if I have a patient with rosacea who's not responded to traditional treatments, I have found a large percentage of those patients have Demodex. And by treating the Demodex with Clearadex, I have found their symptoms improve. Okay. Clearadex offers the patient the opportunity to safely and highly effectively clean the lashes, the eyelid, as well as the skin, in that it uses the constituents of tea tree oil that are known to be highly effective in their antiseptic properties, as well as their anti-inflammatory properties, without the toxicity of those properties of natural tea tree oil. So you're really getting the most bang for your buck in a sense without causing any irritation. Our goal always is to get to the core of the problem and not just treat the surface layers of the problem. When that opportunity comes and when that opportunity is presented to us doctors, it's quite exciting and can cause quite a paradigm shift in the way we treat our patients. Clearadex offers that type of paradigm shift. Clearadex offers me another tool to target the very stubborn conditions that affect the eyelid and the ocular surface, such as rosacea and blepharitis, that often don't respond to what is available to us currently. So it's really exciting to be able to, with enthusiasm, tell my patients that there is a wonderful treatment option available to them. I think what's really important as an ophthalmologist to pay attention to in our perioperative patients is the health of our patients' eyelids and lashes. The eyelids and lashes, especially in patients with rosacea or blepharitis, can really be a nidus for infection and bacteria, and a patient undergoing cataract surgery or refractive surgery can be at great risk for having infectious keratitis or even endophthalmitis. And so those patients can really benefit from the efficacy of Clearadex in clearing or treating the bacterial overgrowth of the lashes and also all the inflammation present. So in my preoperative patients, I'm quite aggressive in starting treatment right away with Clearadex to get to the problem and prevent problems further on. When I see a patient with stubborn blepharitis, especially ones that I've demonstrated mites under the microscope, I insist on them using Clearadex to clear their blepharitis and kill the mites that are present in the lashes, because I know that it can impact the ocular surface long term and cause severe problems if left untreated. In my patients with ocular rosacea or blepharitis, I confidently recommend Clearadex and expect excellent results.